There is no medical practice in the United States of America, or frankly, globally, that is not seeing children who are being exposed to ACEs. The scientific connection between early adversity and the development of short and long-term adverse health outcomes, just this huge scientific, medical, and clinical frontier.
We know that early adversity and trauma are written on the brains and bodies of our children. The time has come to move from awareness to action. The time has come to screen all pediatric patients for early childhood adversity.
Most of us recognize that this is important work that needs to be done, but there are barriers that go with trying to implement this screening, and so being able to share stories really allows you to explore some of those ideas and find a best practice for implementing this screening and intervention models.
I think that the importance of this conference was the ability to make connections with other like-minded people, and specifically sitting at tables with other pediatricians, discussing both challenges and opportunities that face us as we look at implementing ACEs was probably one of the most valuable parts of this whole experience.
I see a vision, I see an everyday where people are talking about ACEs, where people are recognizing its implications and applying it to practice. And you hear that drumbeat, it has become a national movement. It is part of discussions now.
We are looking to launch a 3-year program to get 1,000 clinicians to screen 300,000 children for ACEs.
The ACEs movement is going to be something that revolutionizes, I think, the way that we think about well-child care.
There is a really special place for pediatricians and other primary care clinicians to really lead the way and sound the alarm, to recognize this is a health issue.
I am absolutely honored to be a pediatrician, to be able to care for the most beautiful things in the world. And whenever I interact with a kid, whenever they come to clinic, that's my recharge. And they're the ones that inspire me to keep going and to keep moving forward. They change me every day, but most importantly, they inspire me every day because it's these kids who deserve the brightest future possible.